Welcome to Facts TV News, where everything is true. Man murdered in Morant Bay. The St. Thomas police are probing the shooting death of a man in the parish last night. He has been identified as David Elliott, a 60-year-old laborer of Duane Pen in the parish capital, Morant Bay. Reports are that about 8 p.m. yesterday, Elliott was walking along Bamboo Lane in Morant Bay when, upon reaching a bridge, he heard footsteps coming towards him from behind. The attacker allegedly shot at Elliott. The police say they were called to the scene, and on their arrival, Elliott was seen lying alongside a wall suffering from multiple gunshot wounds. He was rushed to the Princess Margaret Hospital, where he succumbed to his injuries while undergoing treatment. Field hospital erected to relieve overburdened Spanish Town Health Facility. Overwhelmed by a surge in the number of persons with COVID-19 visiting the health facility for medical attention, the Spanish Town Hospital yesterday received a well-needed boost with a 40-bed COVID-19 field hospital established at the institution. The urgent need for the field hospital was emphasized by Health and Wellness Minister Dr. Christopher Tufton, who indicated that St. Catherine, the parish in which the hospital is located, had a general COVID-19 positivity rate of 33%. The field hospital, donated by the United States government, was deployed from the National Chest Hospital to the Spanish Town Hospital. Tufton, who toured the facility on Friday, commented on the importance of establishing the field hospital at the new location. The facility has come at a very important time to deal with the overflow of COVID-positive cases in the parish, and I am sure the doctors and nurses will appreciate doing what they can do to provide as best as possible a response to COVID infections in the parish, Tufton said. He said that a second field hospital, which is expected to arrive in the island soon, would be established in central Jamaica. At present, some 70 persons with COVID-19 are being treated at the Spanish Town Hospital. The Health and Wellness Minister said the field hospital was equipped with 40 beds but had the capacity to hold up to 60. Equipped with connections for power, air conditioning, and other support infrastructures, including provision for portable oxygen tanks, the field hospital will free up wards that had been assigned to treat patients with the highly contagious disease. Senior Medical Officer for the Spanish Town Hospital, Jacqueline Wright James, said that for the past year, the health facility had to employ innovative measures to create additional space. We have basically assigned 2 additional wards to COVID. We have turned the waiting area in the accident and emergency area into a ward. We have transformed the booth into a nurse's station, and we have basically run out of space and some of the various amenities that are necessary for the care of our patients, so we are very happy today, she stated. Responding to the shortage of oxygen supply, Tufton said that things were better now with less stress on the hospital system because of the recent lockdown measures instituted by the government. It has been relieved somewhat, but still a tenuous situation, so we cannot encourage non-compliance. He urged Jamaicans to take advantage of the vaccination blitz this weekend. The government has designated 44 locations for persons to get the jab. Additionally, 50,000 slots have been assigned to tourist workers, teachers, persons aged 60 and over, immigration officer, marine pilots, and others. I have issued an order to the public health system to downsize their amenities in other areas unless it is life-saving and essential, and focus on the vaccination program, Tufton said. According to the minister, this weekend blitz would be a true test of the vaccination exercise and would prove the level of hesitancy and acceptability. COVID-19 death rate increases, 54 reported deaths so far this week. The number of deaths from COVID-19 continue to rise at an increased pace, with 8 people confirmed dead from the disease yesterday, the Ministry of Health and Wellness has reported. This means that since the start of the week, 54 people have been reportedly dead from the disease, with a high of 15 reported deaths on consecutive days, Wednesday and Thursday. The latest 8 fatalities were 2 men ages 96 and 59 years old from Westmoreland, a 72-year-old and 61-year-old man, as well as a 69-year-old woman from the corporate area. 2 women ages 91 and 42 from St. James, and an 82-year-old woman from St. Mary. The numbers being treated in hospitals across the country remain high at 425, of which 44 are critically ill and 25 have moderately symptoms. There were 276 new cases of COVID-19 confirmed yesterday, bringing the number of active cases to 22,268. Overall, Jamaica has had 42,119 cases of the disease. 95 people recovered yesterday, bringing the total number of those recovered to 18,785. Kingston and St. Andrew continues to account for the highest number of cases, with 92 of yesterday's new cases confirmed in the corporate area. St. Catherine had 59, St. James 36, St. Thomas 13, Trelawney 10, St. Mary and Clarendon 8 each. Westmoreland and Hanover each recorded 7 new cases. Yesterday, Jamaica has a positivity rate of 22.7%. Chief Medical Officer Dr. Jacqueline Bisosa Mackenzie has warned that if Jamaica's surge continues, a new strain of the disease could develop in the country. Please remember to subscribe, like, share, and click the notification bell for daily updates.